Okay, so OPA stands for oral pharyngeal airway. Are we going through the nose or the mouth?
The mouth.
Oral, right? Oral, mouth. Okay, so these are OPAs, and they're even color coordinated. And so we measure them before we put them in. So let's use this guy. Let's see here. This is to secure an airway. This is to make sure that they maintain their airway. We measure from the corner of the mouth. For an OPA, we measure from the corner of the mouth to the earlobe. Is that one going to work?
No.
What do I use that on?
An infant.
An infant. I use it on a baby. All right, let's see this one. Too big. Okay, how about that one? Close.
So good. Oh,
We're
never
close.
mind.
We're real close. Maybe there's one more in here. It's a little bit better. That one might work. Let's use that one. So the way it goes in is it goes in tongue side down. This curve pushes on the tongue. Okay? And then once we're in, we rotate it. Okay? And this keeps the tongue from falling back and including the airway, right? So essentially we're going to work in through the teeth, we're going to work it down, and then we're going to spin it. Sit it with it, right? Now, this is great, but if they're semi-conscious and they have a gag reflex, they're going to throw up on them, right? And that just kind of defeats the purpose, because now if they're throwing up and they're on their back, the vomit is going to occlude their airway, right? We don't want to do that. So if they have a gag reflex and they're semi-conscious and it's not working, we can do a different technique, right? Which is an NPA. We don't use an NPA under one condition, and that is if there's any form of facial trauma or head trauma, right? So if there's any type of broken bone, any kind of facial trauma, we don't use an NPA. Okay? So OPA, you can use it if they have a gag reflex. There's plenty of people when they're unresponsive, we put an OPA in, and then as they start to come around, they become more conscious. What happens? All of a sudden you'll hear them start, they start to gag, right? Pull it out, right? We yank it out, right? And so all that is we just pull it out. It's easy. This is a BLS skill. It's super easy. You guys can practice with this at a later date and time, but it's super easy. So again, we go down, push it in, and then twist, and it's in there. Okay? Pretty easy. How do we measure it?
From the ear to the mouth to the earlobe.
Okay, perfect. Yeah, that's good enough for me. Okay, now this is the fun one. I've done this on actual people before. We're not going to do that today.
Does it feel weird?
But yes, right?
Well, yeah,
It
going
does.
up your nose.
It does, right? Yeah, you shove something in your nose. Which that happens to be.
It's like picking your nose times 4.
Yeah, it's like something's going into your brain. Which is really what it feels like. So it's worse, like significantly worse than a COVID test, because this thing is going all the way up and over and back down. So it's going through your nose and then back down into your airway. Okay, so you shouldn't do these dry. Let me back up. So do you guys see how this thing has a bevel?
Yeah.
Okay, see how it's beveled?
Yeah.
All right, everybody look at it. Beveled, right? It's got one side that's shorter than the other, right? So the bevel always goes towards the septum. Okay, the septum meaning the little middle piece in your nostrils, right? The thing that divides your nose, right? The middle piece always goes there. Back in the day, I'll just say it. I'll admit it. There's been times, like usually the NPAs come with like a lube or like a KY jelly to make it slide in, right? Sometimes those are there, sometimes they're not there. There's been moments where I've had to improvise. Leave it. You do that? No? Yeah. So any form of like a liquid or something there just to kind of put on it. It doesn't take a lot, right? So we just put a little slickum on there, and then at this point you literally just slide it in. Ooh, back up. Again, bevel side towards the septum. There you go.
Okay,
That's what
so
it looks like.
See how that goes in?
Yeah.
There's called a contraindication or contraindication.
When would
What
you
does
not
mean?
do that?
Against use. What would be the against use of using that?
Any broken fracture.
Or any white fluid secreted from the nose or ear.
Might be a skull fracture,
Facial trauma.
facial trauma.
Okay, pretty
So if
easy,
you got
right?
broken teeth in here, then this is the better option.
Can you also use the MPA even if they're unconscious?
This one, can I use this one? 100%. That's when we would use it. I don't do this on. I'll do it. I've done it in here on kids. You know what I mean? But like I don't. But we don't do this for people who are awake and can maintain their own airway, right? This is for people who are unconscious to the point where they're not able to maintain their airway, right?
Without a gag reflex.
With
Well, on the opiate, NPA, you can have a gag reflex.
Yeah.
It still gags you, but not as bad.
So you can basically it's two things, right? So the OPA, you can use them on anybody and everybody. If they have a gag reflex or they begin to regain their consciousness and begin to regain that gag reflex, you're gonna have to pull it. With the MPA, you can use it on anybody and everybody, with the exception of anybody who's received any form of facial trauma or any type of head injury, right? So anything going on here that would require some blood or some stitches, we're probably not gonna put it in. Okay? Does that make sense? Beautiful. Pretty easy. Anybody want to try it?
Try it.
Yeah, dude, grab some gloves. It's got KY jelly on it, so I don't know if you want to. If you want to glove up, you can, but you don't have to.
Smalls.
Yeah, grab some gloves and try it.
There's mediums.
How many? I don't know how many times you're gonna get to try
There's
it.
mediums.
For everybody else,
Large.
listen up,
Large.
listen up, listen up. For everybody else who's not doing this, there's not multiple people all doing this at the same time. For everybody else, clean up. Grab some mannequins, put the babies away.
Before we put the
Break it
tables
down.
away, let's put the mannequins away.
Yep.
That doesn't take all those. We got a box under here where all those,
Yes. Yeah. Don't put those in there. Nope.
you gotta take the heads off and put them inside the bags. Decapitate them.
Where's the gloves?
Oh, they're over there.
With me? The large one next to the
Decapitate them.
Even the babies?